Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation. And with today's episode, we're teaming with PRC. This podcast is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. Today, we're going to be discussing Cares Connect, elements of an effective discharge solution. And today's podcast guest is Kathleen Lynam. Kathleen serves as an executive coach and senior advisor with the Healthcare Experience Foundation, and we highly recommend going back and listening to some of the earlier episodes she has joined us on so you can learn more about her and her background.
Good to be here, Casey. Thanks for having me.
All right. So, how damaging can a poor discharge experience be for patients, and how can it have a negative impact on otherwise excellent patient care?
Well, that's a good question. And actually, the answer is quite simple. The primary damage that can occur with a poor discharge experience is related to patient safety. And that is the inability to understand perhaps post-discharge instructions, or more importantly, not understand how to take their medications. So a poor discharge experience can reduce the opportunity for a patient to ask questions or clarify concerns. So really, safety and the risk of readmission that might occur because of that is probably the biggest challenge. But secondly, there's another underlying result from a poor discharge experience. And I want you to think about the last impression that we have with any experience, whether it's a hospital admission or a discharge from a surgical, a same-day surgery, even a new restaurant, or even an experience at Disney. The last part of that stay is what we remember most. So it can actually destroy a fabulous patient experience or a Disney experience or a restaurant experience and make the difference between a good and an excellent experience. So we know in healthcare that discharge process, we call it about the continuum when somebody leaves a hospital or an acute care and goes to home care or rehab. That's a very pivotal time. And certainly in the most challenging times recently with COVID, when many patients are alone and anxious to leave, yet unable to listen and understand all their instructions, there's an opportunity for a negative outcome to happen even after a perfectly good patient experience.
So, in what ways does discharge communication commonly fall flat? I want to get your opinion on what some of the main flaws are.
Communication flaws is probably the number one challenge we have in healthcare everywhere. It's the number one cause of errors. And so it goes back to the risk of a patient not understanding specific instructions or medication compliance. And that is always the responsibility of the discharge team, which includes the physician, the nurse, the therapist, care management. And often the breakdown, those flaws in communication happen for a variety of reasons. Things distract a healthcare member from spending the time with patient and family to not only review the medications, but ensure understanding. That's where we have those breakdowns. And it could be because staff are burdened with heavier patient loads or managing complex patients, where we have today the variety of agency nurses and travelers nurses who are all, I'm sure, generally good, but understanding the nuances and the need for spending time with patients before they leave is critical. And then we have the compression factors from emergency rooms saying, is that room available? Is that room available? So there's a lot of ways that the communication at the point or primarily before discharge can be impacted. And I want to also share that preparing for discharge happens from the minute you're admitted. We really try to set the patient and their family up for expectations and reinforce throughout their stay. But honestly, the further challenges from COVID with not only the the gowns and the masks, which interfere with not only understanding and listening, but those restrictions with patients' families not being present is really a huge factor. Oftentimes, when we're doing discharge instructions, we want to ensure not only the patient understands, but the family member does, so that there's sort of redundancy and safety there. So I guess in summary, there's tremendous opportunities for breakdown and communication to happen in all of a patient experience, but certainly at the end when they're getting ready to go home.
Now we're really going to get to the heart of today's discussion here with this next question. So tell us about the essence of Cares Connect as a discharge communication solution. How does it create safer patient outcomes?
Well, I think Cares Connect is really a wonderful safety net. And let me just explain the technology briefly, because I'm not a tech person, but upon discharge, the files of the patients are sent to this organization, PRC, which enables, and they are able to download the information about the patient 4 to 48 hours of discharge, that those patients will be called by a trained interviewer. Now, the process of calling patients after discharge has been around for a while. When I was a young nurse manager on an orthopedic unit, we really made the attempt to call our patients the next day to make sure they understood, or did they have any new questions. So this practice is recommended by the Joint Commission for a variety of high-risk patients, for emergency department and ambulatory surgery patients who may have a limited time in our hospital. But the challenge that we faced in the last few years with the turnover in not only in staffing, but the frequent change in our patients makes it very difficult for staff to really effectively call those patients that they cared for. So the fact that there is an organization with trained personnel to make sure and commit to calling those patients is a wonderful, wonderful way to ensure questions are answered. And the information gleaned from those questions is electronically submitted back to the unit where they were discharged. And so leaders and members of the team can review that information daily. And if a patient, while on a call, needs to speak with a physician or a nurse, the interviewer can facilitate that immediately and support the patient while doing it. So it's a beautiful blend of technology and human touch that make this a great, great safety net.
And based on this discussion alone, we know that post-discharge communication is commonplace these days. But what makes Cares Connect stand out from the other discharge solutions?
Well, I think a number of wonderful things differentiate Cares Connect. First of all, the guarantee that they can make the call to all of the identified patients is a fabulous, fabulous safety net. The reality is in the busy hospitals and surgical centers today, probably less than 50% of the patients get a phone call. So we have right away, we're getting more patients on there. And those organizations that utilize Care Connect create with the team the most optimum questions that can identify or flag any need for immediate follow-up. So safety is primarily the primary focus there. And so the third part that I think is really important is that these interviewers are not random telemarketers or robots. They're not a robotic question that gets sent to somebody, but they're human beings who have been trained that are screened, and they participate in our behavioral-based cares training so that we can ensure that each and every patient is treated with respect and, most importantly, with empathy.
I want to ask about empathy now. So why is empathy so critical?
Well, I believe empathy is the foundation of a great patient experience, because we know that during a hospital stay, the most important factors for a patient is that they feel like they were listened to and cared for. And that means the people caring for them have to be empathic. They have to be able to, if you will, put themselves in their shoes and understand and verbalize how they might feel, whether it's frightened, frustrated, angry, worried. To be able to connect with someone on a human basis is so important for all of us. So the fact that we also train our interviewers to be aware that what would you feel like when you got out of the hospital yesterday? Probably overwhelmed, worried, anxious, or maybe just grateful to be alive. Having those skills allows them to negotiate a conversation and an interview and communicate to the patient as, if you will, an extension of the hospital. We care about you. We care about you, even though you're not in our hands right now. We care enough about you to reach out and find out how you're doing. And that is critical. And in fact, in some of the patients that we've already done with other organizations, patients have cried and said, "Oh my goodness, that's so nice. Thank you for calling. I feel so valued and appreciated." That makes a big difference. And so empathy is critical at every stage of a patient experience, especially when they get home.
How is it possible to make sure patients feel as though the hospital is contacting them with a genuine concern for their well-being after the hospital experience has concluded? And how can this experience better be humanized?
Part of our teaching and coaching in hospitals is to make sure our goal is that everybody has an excellent experience, which means good quality care, compassionate, caring staff. And so the most effective way to ensure that is by having the team members who are caring for the patients throughout the stay set them up for success. In other words, prepare them for the call by saying, "Listen, we know that we've given you a lot of information and you may not have questions now, but you probably will have questions tomorrow. So not to worry. We care about you. In fact, tomorrow you're going to be getting a call from our organization. And the purpose of that call is to answer any questions that came up and find out how you're doing. So keep your eyes and ears peeled for a call from the hospital number." And that's our way to ensure that certainly the patients are prepared and recognize, wow, this is above and beyond. My hospital cares about me enough that they're going to do a follow-up phone call tomorrow.
And when it's done right, what are the benefits of effective discharge communication?
My 2 cents on that is they need to be done now more than ever. Ensuring that our patients are called after discharge is so critical for not only as I started out with, their safety, the reducing the risk of readmission. We know that based on healthcare literacy, based on when people are afraid, they can't hear so well, they can't understand. And so compliance with medication regime, with treatments for wounds and all that stuff, the most important thing is that patients understand. So the benefits are better patient outcomes, less hospitalizations, and I think more importantly, quicker healing and improved loyalty or appreciation to the hospital and the nurses and the physicians that they were discharged from.
Ladies and gentlemen, you've been listening to Kathleen Lynam. She is an executive coach and senior advisor with the Healthcare Experience Foundation. Any other parting words you wanted to leave us with before we wrap it up here?
No, I appreciate those who are listening and what you're doing every single day, because they are our unsung heroes, and our patients are better off because of all of the nurses, therapists, managers, leaders who are doing this, and physicians. So I thank you for what you're doing and encourage your organization to find out about this CARES Connect, because it's a great way to ensure the safety net that you all want but are not able to do. And thanks for inviting me, Casey.
Oh, of course. And I'll let that be the final word for today's episode of Healthcare Experience Matters. Thank you again, Kathleen.
Take care. Have a good day.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation, with today's episode teaming with PRC. To learn more, visit healthcareexperience.org. That's healthcareexperience.org.